Hi, this is Anita, one of the OET trainers at Alliance Academy, and in this video I am going to talk to you about a speaking topic. Okay, and here you are going to talk to a patient who is scheduled for an inguinal hernia repair surgery, and the patient's work involves heavy lifting as well, and he doesn't know anything about the inguinal hernia, and he doesn't even know the relation between heavy lifting and inguinal hernia. Okay, and you have to explain about the preoperative care as well as the postoperative care also. So this is the patient's background and the setting is hospital surgery ward. Okay, so first thing you need to know is the patient's background and the setting. So it's the conversation is taking place in the hospital surgery ward, and you have to explain to the patient everything about the surgery as well as preoperative and postoperative care. Okay, so before you start your conversation, you need to know if this is a known case or an unknown case. Okay, so here I'm going to do this as if I don't know anything about the patient, because it's a hospital surgery ward and I'm going to take care of this patient for the first time. Okay, as well as the name is also not given in the role play. So if the name is not given, you can ask the interlocutor during your preparation time, like how may I address you during the role play. Or if you have forgot to ask the name during your preparation time, you can ask when you start your role play. Like after the introduction, you can ask the patient, before I proceed, how may I address you. Okay, so the patient's name is very important in your role play, because you need to use the patient's name throughout your conversation. Okay, so here my patient's name is William. Okay, so I am going to address the patient as Mr. William. Okay, so the first and foremost thing you need to do when you start your role play is greet the patient and introduce yourself. Okay, so here I am going to start the role play like this. Good morning, Mr. William. My name is Anita and I am one of the registered nurses in this hospital ward. I am going to take care of you today. So, how are you feeling now, Mr. William? Okay, you can either start your role play like this, how are you feeling, Mr. William? Or else you can start like, I understand that you are scheduled for a inguinal hernia repair surgery today. Am I right, Mr. William? Okay, so if I ask him how are you feeling today, the patient might answer, I'm not well because I'm scheduled for a surgery and I don't know anything about it. I'm so scared about this. This is the first time I've been admitted to the hospital and I never had any surgery before. So I'm really worried about my surgery. Okay, so if the patient tells you some concerns like this, first thing you need to reassure the patient by saying that I can understand, or your concerns are understandable, Mr. Williams, but I'm here to help you. I will explain everything in detail. Okay, so first thing you need to reassure the patient. Okay, so now you have to look at your task. Okay, so here the first task is find out about the difficulties the patient has been experiencing. Okay, so even though the patient has told you some concerns about his problems, after the reassurance you have to start with your role play. You have to start with your task. Okay, so the first task here is find out about the difficulties the patient has been experiencing. So you can ask like, your concerns are understandable and I will help you to get rid of your problems, or I will explain everything in detail, but before I proceed further, can I ask you some questions related to your problems? Is that all right, Mr. William? Always you have to ask permission from the patient whenever you ask some questions to him. Okay, so here when you ask the patient like, is it okay if I ask you some questions about your problems? The patient might say, okay, that's fine, nurse. Okay, now you can ask like, could you please tell me what problems have you been experiencing so far? Okay, so the patient might say, actually my work involves heavy lifting, and whenever I try to bend to lift heavy weights, I used to feel like something is protruding through my groin area, so it really affected my work. Okay, so now he is explaining the symptoms of hernia. Okay, so you can answer like, that's what exactly mean by inguinal hernia. So this is the same symptoms you will experience in this case. Okay, so the symptoms of inguinal hernia includes feeling of a lump or a protrusion in your groin area. And let me explain to you the reason behind it. So you already mentioned that heavy lifting is one of the main reasons for hernia. See, sometimes due to some problems your abdominal wall will weaken, and through this weakened area some internal structures, especially the intestine, will protrude through this weakened area. So that's what you feel when you try to lift heavy weights. Okay, so you have to explain everything in detail about what is meant by inguinal hernia. Okay, then you have to acknowledge that the patient understands everything. So you can ask, is that clear, or am I clear to you so far, Mr. Williams? Okay, so the first task is over and the patient might say, yeah, I understand it. Okay, and the second task, explain about the purpose of the surgery. Okay, so the patient doesn't know anything about the surgery, so you have to explain the purpose of the surgery. So the surgery is the only treatment option in case of hernia, because we need to do the correction of this hernia, otherwise it's going to make further complications. Okay, so here the surgeon is going to do the surgery through through keyholes. Okay, so sometimes if you say laparoscopic surgery, the patient might not understand the word laparoscopic. Okay, so you have to explain it in a layman language, like it's a keyhole surgery. Here the surgeon will make 3 to 4 small openings in your abdominal wall instead of making an open incision. Okay, so this is it's not a complicated surgery, it's like a minor surgery, and you can go home within 24 hours if there is no complication, and it's easy to perform, as well as there is a speedy recovery also. Okay, so you have to explain everything in simple words about the surgery also, and then you have to make sure that the patient understands it. Okay, like, is that clear to you so far, or am I clear to you, or did you understand what I am talking, what I have discussed so far, or are you following me? Okay, always check the patient's understanding about your talkings. Okay, so this is the second task, and the third task, explain the immediate post-operative period also. Okay, see, when you explain about the immediate post-operative period, you can explain like, see, after the surgery the doctor will cover the openings with a mesh, or he will cover it with a waterproof dressing. Okay, and you will be shifted to a recovery room. There you will be monitored continuously, and there will be a nurse with you all the time to monitor your blood pressure, temperature, as well as your incision. Okay, and and moreover you will be having some anesthetic effect also, because during the surgery you will be sedated by giving some medication, so the anesthetic effects will be there once you are in the recovery room, and after the sedative effects has gone out, or after you recover from the anesthetic effect, you will be transferred to your ward, and you might feel some kind of pain, but we will give you some pain medication. So whenever you feel pain, you have to let the nurses know that you are in pain, so that the nurse can give you some pain medication also. Okay, so you can explain something like the immediate complications, as well as immediate adverse effects or side effects also, like sometimes the patient may experience some some anxiety because of the surgery, and moreover because of the because of the anesthetic medications. Okay, some anesthetic medications have some side effects like anxiety. Okay, so this is normal, this is expected after the surgery, but we will monitor you continuously, and you will be safe in our hands. Okay, so even though you explain the side effects to the patient, you still have to reassure him by saying that you are in safe hands, so we will take good care of you. Okay, so and also you have to explain about the post-discharge care also. So here you should be very careful in your immediate post-operative period. Even though we discharge you within 24 hours, you still have to be very careful about your wound as well as your activities. Okay, you have to keep your wound dry and intact, and you are not supposed to do any heavy lifting also, and you have to take leave at least for 2 weeks from your work. Okay, and the complete recovery will happen only in 6 weeks, so it will take at least 6 weeks for the complete recovery. So until that time you should be very careful about your incision also. And you have to explain that he should avoid constipation, because when he strain during defecation, it can cause protrusion again, or it can cause some pressure in the incision side, so it will cause further complications. So you need to avoid constipation. So for that, drink plenty of water as well as consume high fiber diet, like consumes lots of fruits and vegetables. Okay, and he should avoid strenuous activity for 4 weeks also. So this is the same like constipation. Okay, so when he does strenuous activities, it will give pressure to the incision site, and it can cause further complications as well. Okay, so this is how you need to give advice about post-discharge care or post-operative care. Okay, and you can explain to the patient about his personal hygiene, like showering. The patient might be concerned about showering because he has the incision, so he might be scared when he showers it might get wet. So you need to explain to the patient that there is a waterproof dressing. See, after the surgery the doctor will cover this with a waterproof dressing, so no need to be scared of wetting the wound when you do the showering. Okay, so showering is possible, or showering is okay. He can take shower after the discharge. Okay, so this is how I would do this role play. So I hope this would help you a little bit. Okay, if you have any questions, you can text me in my WhatsApp number. Okay, thank you for watching.